Next on Newsmakers, the latest trends in cosmetic plastic surgery. Stay tuned. Good evening, I'm Deborah Caldwell-Martin. Last year, more than 1 million people in this country decided to go under the knife in an attempt to look better. It has even become acceptable for Miss America to have surgical help in enhancing her natural beauty. Tonight, we will talk about cosmetic plastic surgery with my guest, Dr. Frederick Barr, who practices in West Palm Beach and is a member of the American Society of Plastic and Reconstructive Surgeons. Dr. Barr, what sort of training is involved to become a member of the American Society?
Well, first of all, good evening. What happens is the following. There is 4 years of medical school, followed by either a 3 to 5 year residency in usually general surgery, followed then by either 2 or 3 years in plastic and reconstructive surgery. So in my case, it was 14 years total, counting college.
But a plastic surgeon who is certified by the American Society of Plastic Surgeons is not the only type of doctor who can perform these operations, who can perform cosmetic surgery. Is that right? Well,
it's a very touchy subject. Basically, what it amounts to is what your training is. There are those of us that are well trained in all areas, and those of us that have degrees that maybe are not so well trained. So I think it really comes down to the first thing that a prospective patient should look for is as what they find with that surgeon, what the credentials are, do they have the baseline credentials, and then how comfortable they feel with that surgeon. I think they need to look at several different things.
I would imagine you should also find out how often that surgeon has performed the type of surgery that you're interested in.
I think that that's true. I think that a good part of it really comes down to is really what your gut feeling is. You can have, again, the best credentials in the world, and you can do all sorts of things and have great PR. But when it comes down to having good judgment, when it comes down to being able to relate to you as a person, to being able to see what you individually want and what can be performed for you, then it's a different topic, and particularly when it comes to the area of cosmetic and reconstructive surgery, which is very personalized.
Cosmetic plastic surgeons can, in fact, advertise, and I know many people have seen ads in newspapers or even on TV and probably have said to themselves, now, how do I know if he really is good at what he does? I know the Palm Beach County Medical Society keeps a track of all of the doctors in the area. Would that be a place to go to ask questions?
I think that's a very good place to go to ask questions. There is an 800 number for the society that I belong to, which is the American Society for Plastic and Reconstructive Surgery, and that is actually the board that I have taken in past, and the society is sponsored. The American Board of Plastic Surgery is the only approved board by the American Board of Medical Specialties, and as far as that goes, that is the board that we look to, and that is how we process things. So I would recommend calling either the local medical society or calling to the 800 number for the American Society of Plastic and Reconstructive Surgery.
What are you finding as the most common type of cosmetic surgery that is being either requested or performed today?
Well, I think overwhelmingly the things that statistic-wise show is the liposuction, or the fat suction in the vernacular. I think then it becomes different things. What I've seen in my practice is eyelid surgery, nasal surgery, facial surgery, breast enlargement, reduction, or reconstruction. Those are the things, not necessarily in that order, that come into line at this point.
You mentioned the breast surgery, the breast implants, and I want to explain to our viewers that we do have some pictures of surgery tonight. Some of them are considered to be graphic. Dr. Barr probably doesn't think so because he deals with this on a daily basis. But if you are a little bit squeamish in the stomach, you might just want to listen and not watch, for the next couple of minutes. But we do have some slides of, for instance, a breast implant, so I just wanted to forewarn you. And Dr. Barr, maybe you can explain when someone comes into the office and says, I want a breast implant. Is everyone or anyone a candidate, or what kind of consultation is there?
Well, I think the first thing is that the misconception is, as you say, I want a breast implant. I really have to come back again to individualization with the patient. When a patient calls on the phone, where I know we may have trouble is that they will say, I want a breast implant, or I want liposuction, I want this, I want that. I then try and say, well, perhaps that may be what you want, but why don't we get together and let's look at what the problem is first. Let's define the area that you're concerned about and then see if these different things can fit into it. For breast enlargement surgery, when somebody comes into the office, the usual complaint is that they feel that they do not fit their clothing correctly. And that probably is a #1 indication for doing the surgery. Not that it's going to change their life, not that it's going to help a failed marriage, not that it's going to do any of those things, except to make them feel hopefully more proportional and make it easier for them to buy the clothing, which unfortunately today is fit to the ideal proportions. And as we all know, none of us are ideal and none of us are perfect, so it does become very difficult for particularly the female to be able to fit into clothing with a variety of clothing there is and to feel comfortable unless she approaches a more proportional body stature, and the breasts are one of the areas.
Now, the first slide we are going to take a look at actually is a case of yours that is reconstructive surgery, and I believe this was a patient who had some lumps on her breast, cancerous, malignant lumps?
I believe so. As it comes up, this is a lady who had bilateral cancer, but this slide unfortunately is out of context here. There is a slide before that that shows where the actual bruising from the biopsy that was done, and then what happens is there are many different ways of performing the surgery, but the way that this lady had had her surgery was what we called a immediate staged reconstruction, whereas the general surgeon will go ahead and remove the breast, and that means removing the nipple, the areola, which is a dark rim around the nipple, removing the skin and removing the breast glandular tissue, and going down to leaving just the muscle, which is a modified mastectomy or simple or total, depending on whether or not the lymph nodes are involved. And then at that time we will take a device, which I have here.
All right, maybe I can hold that up for you.
Sure. This is what we call a tissue expander, and this is, as you can see, a silicone bag that is empty now, and it has a port or tubing from that with a fill port, and this tissue expander is inserted underneath the muscle, and then the skin is closed on top, and the patient then will stay in the hospital or be discharged depending on how her postoperative course is, and then come back to the office. And as healing occurs in the next week or two, we will begin as an outpatient procedure to fill this tissue expander. And much the same as we would see in pregnancy, how the tummy expands, is this is the principle that we're doing to stretch out the muscles, to stretch out that overlying skin, to give an approximation of a breast mound. Obviously, I wish that I could reconstruct a breast that is identical to what God has given us, but I cannot, and I do not know anybody that can. So what we're working with, again, are the imperfections, but working the best that we know how to achieve something that a person would feel comfortable having, as far as being able to fill out a bathing suit, being able to wear her clothes, not using an external prosthesis, which can get pretty sweaty or hot or even smell or fall out. So what we're trying to do is approximate what is and what was by using this procedure. Now, at a later time, we then have the option to go back and either remove the tissue expander, if that's the type that we're using, and then put in a regular prosthesis, which is a silicone bag with a silicone coating that is textured and has silicone gel inside of it. And this will then act as a permanent implant to maintain the shape and form of the breast that we've tried to create. At a later time still, if the patient would like to continue, to go ahead with a reconstruction for the nipple and areola.